Hello, YouTube. I am Dr. Joanne Balude, and I am speaking to you today on the do's and don'ts of telemedicine. And I really wish there was a video like this when I first started telemedicine, but unfortunately there wasn't. And I kind of had to learn on my own. But I feel so strongly about this topic and the experience that I've had that I decided to go ahead and put together this video for physicians, nurse practitioners, or any type of medical personnel provider who's going to be doing telemedicine. Maybe you may currently be in it or you're thinking about getting into it. These are some of the things you definitely need to watch for. First of all, let me just say I think telemedicine is something that is so beneficial and it's such a blessing. It can be a very good thing if used in a good way. It's efficient. It helps patients have better access to medicine who, for various reasons, may not have otherwise. For example, if a patient is debilitated or, if they're handicapped, they cannot drive themselves to their appointments, don't have family members or the support they need to get them there. Or if a physician just wants to keep, a tighter regulation on the patient and just see how they're doing. So telemedicine can be one of convenience and can help to increase access, especially because some patients just don't have the money to pay for the copays with insurance, and they're pay as you go or self-pay. And to pay for a telemedicine consult is much more cost effective for them than to pay all these large copays for the year. So not only that, for the physician or the provider, whoever's giving the care, I mean, who doesn't want to work from home? So it's a great way to have the best of both worlds, when used well, both for the patient as well as the providers. But when not used well, it can go bad and it can actually be very hurtful, not only to the patient, but also to the physician who's trying to do no harm and provide good care and good service. So we're going to start off with the don'ts, okay? So number one is you want to stay away from companies that will tell you that they have pre-filled orders or medications that you are allowed to select from. Because what a lot of times these companies do is they will select a list of medications that would do the same thing as other meds, but their selected meds are 10 times more expensive. So they can put more of a charge to insurance companies in their billing, which is not right. And if you were in the office as, an outpatient provider, you would want the autonomy of ordering the medication that you think would suit the patient best based on the patient's chief complaint. So you don't want to go with a company that's going to take away your autonomy to do that for your patient. Secondly, you want to stay away from companies that are dealing with durable medical equipment. I'm sure you've probably already seen this in the news because I think there's more awareness right now concerning this. But a lot of these companies that are marketing DME through telemedicine, they've been caught in a lot of scams and fraudulent activity because they're taking these medical devices and they're charging a lot more than they truly should. When they should be half, if not a third of the price, they're overcharging insurance companies, which is also not right. Thirdly is you want to be very careful for companies that will tell you we only deal with the insured patients. Because as a physician, as a provider, you want to do no harm first. And we get into this business because you want to help people. And so, like I said earlier, one of the big assets of telemedicine is to be able to provide care for patients who otherwise would not have access to medical care. And so for many patients, let's just face it, the reality is a lot of people can't afford the copays. It's very expensive to pay these premiums for the whole year, especially if you have a big family. And so some of these patients will just do pay as you go, or they'll be self-pay. and it's much more cost effective to go through telemedicine. So if you encounter a company that says we only deal with those who are insured, that would defeat the whole purpose of trying to help that, segment of population that doesn't have access to care because they can't afford insurance. And oftentimes, the reason why some of those companies are so selective for that patient population is because they want to charge these insurance companies an arm and a leg. They want to charge them way more than they should um, in attempt to make such a gain and a profit. Okay, so this should also come as a red flag to you as a provider. Now, I'll tell you my own personal testimony. When I, right as I just started telemedicine, I had just finished working as an outpatient attending physician for both internal medicine and pediatrics. I was just new to this whole thing, but what I was looking for was an opportunity to provide good patient care as well as, to work from home and have the best of both worlds, to be able to work with my patients as well as to have my family life and take care of, my kids and do things at my own pace. So it seemed like a wonderful, wonderful option. Now, the first two companies that contacted me, the first one was a DME company. They specialize in DME as well as they had pre-filled orders. The second company, they provided pre-filled orders, and they told me that I would be looking at orders that were already transcribed by a non-medical personnel. They would talk to the patient, find out what the patient's chief complaint was, and these were all patients who had pain. And of course, they were not being prescribed narcotics or opioids, anything like that. We know that's a no-go area. But these were going to be just routine pain medications that I would prescribe as an outpatient in the office, which seemed fine. But my question was, I would not be, talking to the patients directly. And so I, new to the whole telemedicine world, I said, okay, well, let me call my licensing authority since I don't have much knowledge on the issue. So I called Texas Medical Board, spoke to someone from the switchboard, and explained to her the situation. And she asked me a few questions and ended up telling me because if I have a full license, Texas medical license, as well as I'm only prescribing prescriptions for patients who are located in Texas, she said that was fine, that would be classified as remote patient monitoring. And I wrote it down and I said, okay, because I'd never heard of it before. And I took it as that, I took it that she knew what she was talking about. I just trusted her. Came to find out that was not the case and that was incorrect. So just for those who have heard the term or have not heard the term before, just for clarification, remote patient monitoring is when you use objective information regarding a patient's condition to make medical decisions. So, for example, taking blood glucose sticks and making decisions on what to do with their diabetic medications, whether to increase or decrease the insulin, or taking objective measurements of blood pressure and deciding how to better manage the blood pressure based on how the patient is responding to the treatment. So that is true remote patient monitoring. It's not when a non-medical personnel will talk to the patient, get the information, and then send that information remotely to you. That is something else. So the other thing to learn from that situation is always write down who you talk to, because unfortunately, in my case, I did not write down the name of the person from the TMB. And so cannot go back to see who misinformed me of that information. Okay, so that's one major thing that you want to learn from. And the other thing too is, just so you know, The reason why a lot of these things can be scams, and as a physician or a provider, you can be wrongfully implicated, is because some of these companies that are doing fraud, they are getting kickbacks, and the provider who has been hired, who's making about 25 to 35 or $40 per consult, has no clue of what's going on behind the scenes. But because the kickbacks from maybe obtaining the patient's information is being given to the company, they get a certain amount of money for that, which is as a kickback. And these companies use the money that they get to pay the providers or the physicians or the nurse practitioners, whoever's doing the prescriber. And so, whether knowingly or unknowingly, because the payment is coming from these kickback funds, indirectly the provider has been implicated in partaking in fraudulent activity. I know, that's horrible, right? That is, it's something that definitely has to be considered and has to be scrutinized. That innocently someone can unknowingly be implicated, for something that is fraudulent when there was no intention there to begin with, as far as on the provider's part. So now, what are some ways to really look at, so you can kind of screen these companies when they are, contacting you or interviewing with you? One thing I would say is look at the company and how visible they are. What is the visibility of this company? So always find out who is the CEO of the company, the name of the CEO, and find out the address. Where is this main company located? Because a lot of these fraudulent companies will have a major company in a different state and will open small franchises or little groups in different states that they plan to keep in operation for a few months until they reach their quota or their goal and profit, and then close down or shut it down once they're done, and then they move on to another state. So make sure you know where the major company is located. Find out the phone numbers, the major phone numbers. Make sure they're not just giving you cell phone numbers of the recruiters, whoever's talking to you, because you need to know what's the follow-up for that patient. When the patient puts down the phone, as a provider, when I finish talking with them, or whoever is on the other line getting information from them, what is the number that they're being given to be able to call back if they have a question, or if they don't see their medication, or if they get a reaction from the medication? How is follow-up being managed with these patients? That is so important. And then another thing to also make sure you ask is, how are they acquiring their patient? Where do they get their clientele from? If patients are somehow confused of how their information was accessed for the consult, then that should definitely be a red flag that something fraudulent could be going on, or patient information is being backhandedly supplied by another company. And this is not something that the patient was willfully or consciously reaching out for. So those are some things, very important things to look for as red flags when deciding what company that you want to reside with. Now, as far as good telemedicine practices and companies, what are some good signs? So one of the things is that you need to make sure that you have face-to-face with your patient, okay? This is very important because it allows the patient to be able to ask questions. It helps to develop that, trust relationship with the provider, whoever is going to be talking to them, assessing them, and then prescribing the medication. Trust is so important in our line of work, and you don't want to lose that element. And if you're not talking to the patient directly, that very important piece can be lost. Now, also physical exams. Now, of course, it can be difficult to do a physical exam when you're not directly in office with a patient. But there's certain things, certain ways to go around that. For example, you can ask the patient to, touch over their cheekbones, apply pressure to their temples, apply pressure to their abdomen, certain things that can help you to determine if there's tenderness or pain there, to help with the physical exam portion. So, as a provider, you can get really creative with different things that you can do, but it's very important. They can open their mouth for you to see. You may not be able to see as well as you would if you were in the office, but at least you can see if there's white patches or if the tongue is red or, just various things. So that's important that, you have some type of face-to-face in telemedicine. The other thing, too, is important when you talk to patients to have the adverse effects of medications, have that discussion with them. If you're prescribing this medication, they need to know what are the possible things that I need to look out for, that if I'm taking this medication, it could do harm, or I may need to stop it and call you back as my provider right away and let you know that I have this symptom, or I may need to go into an urgent care or an ER because of a reaction. So that's very important. So these are just some tidbits that I hope help you. And like I said, I wish I had known, but it's better late than never that we get the knowledge. And so I just want to share my experience and the knowledge that I've come to with other providers so that you can learn much earlier in the process. Because as a provider, especially for physicians, we've been in school for over almost 30 years, taking exams, going through training, just sacrificing a major part of our lives to be able to help other people. Because most of the time, that is why a person gets into this field, not because of the money, because there are many other things you can do if you're looking for a profit, but it's really to help people. So when you have gone to school so long and you've made such sacrifices in order to do that, you want to make sure you're being very diligent to be aware that there are people out there that are on the prowl, that are looking to make a profit off of you. And if you are, not astute and not paying attention to detail, those things can be missed. So you want to make sure, because you did not go and make so many sacrifices for so many years just to have someone come along and to engage you in fraudulent activity, whether knowingly or unknowingly. So, the Bible says, my people die for lack of knowledge. So this is a very important example of the need for us, as medical providers to get the knowledge so that there is not a death of medicine, or there's not a disservice that's being done to patients, as well as to providers, as well as to insurance companies, because many people get hurt in the process when things are not done right, and when there's a lack of knowledge. So I hope that helps you. Leave your comments. I'd love to hear if you have any testimonies or any examples or things that you're going through. But God bless you. All right.